Hey everybody, Jim Chester here, coming to you live from Clearwater, Florida. I have Julie McLaughlin with me. She is a chiropractor, but she's doing amazing things, and you just joined the ChiroThin family, right?
I did in July, just this past July.
So what has it been like for you since you've jumped into this ChiroThin group?
It's been amazing. The first month we had 9 new patients starting, and every one of them have done unbelievable. I mean, we have not had a single person that has not done amazing, and it's really, really been great.
And I know that before it was like really cool to like practice functional medicine. That's what you're doing. So tell us a little bit about your journey and how you got to that.
Well, I've been practicing for a long time, and I don't even want to admit how long it's been, but it's been a long time. And I've been practicing functional medicine before it was even called functional medicine. And so we called it chiropractic because we're looking at the cause and treating the cause rather than the symptom. And so this ChiroThin, this weight loss, goes right along with that for us.
And I'm sure that you realized that people were not getting healthy quick enough. So you wanted to look at like the blueprint of the human, and the blueprint of the human is their labs. Why is it so important to understand on a molecular level, what's going on with a person?
So we look at a lot of labs. We look at advanced lab markers. I've been teaching it for a long time as well. And when you look at that physiology of the person, you can make your medicine, your treatments very, very personalized. We use supplementation, we use diet and lifestyle, and basically it's called the chiropractic lifestyle, right? That's why we do it. And so those labs are so, so important to make it so personalized for each individual, and then you can see if it's better or not. I always tell the patients, you're not going to come in and say, oh, my liver feels much better today, right? We're going to see the before and after, so the proof is in the labs.
And a lot of people might not know this, but this is basically like x-raying like the internals of somebody and finding out what's going on without doing fancy ultrasounds or any type of like organ imagery, but you can actually see what's going on in the blood.
Right, absolutely. I mean, we look at inflammation markers, we look at advanced lipid markers, all the cardiometabolic stuff. We look at the cause. I just had a patient this last week. She's been to like 7 different doctors, and she comes in, and because the way we look at it, we look at preventing and reversing rather than just waiting till their house is on fire. And you can really make those changes in those people and really save a lot of people's lives and their health.
Because I know so much of what you do as a chiropractor and as a practitioner, it's all about the outcome.
Right.
People come to you and they are on fire inside, and then you have to like put the brakes on and say, okay, just trust me, trust the process, know that I have your best interest in mind, know that this isn't my first rodeo, and I'm going to do the best I can to get you where you want to go.
Correct, yes. And sometimes they don't believe you in the beginning because they say, like, why didn't anybody else know this? Why I just spoke at 2 hospitals in our community. Why didn't my doctor do this? And these are post-cardiac rehab patients. And I'm like, that's a good question. You need to ask them, because at the end of the day, when you can make those changes, they not only feel better, but their labs are reversing, they're losing weight, their inflammation's down, they're reversing diabetes, they're preventing heart disease, they're lowering their cholesterol, all without the use of drugs or medication.
So one of the things I want to touch on to you about is metabolic syndrome. And I know that chiropractic does it, you can adjust the daylights out of somebody, but it's really hard to get the nervous system to go into effect to actually get people to actually cut weight. Now, why is ChiroThin such a positive influence for somebody that's challenged with metabolic syndrome?
So with metabolic syndrome, that is so complex because we're involving heart disease and blood sugar combined with the weight. Right? So we know the Framingham risk assessment has been used for like 40 years. They never looked at a person's BMI. And that's the way that labs and medical doctors are assessing people. So if you don't look at someone's BMI and you don't change their weight, you're never going to change their blood sugar. You're never going to change their cholesterol. And so with the ChiroThin, it lowers their insulin, and insulin's a fat fertilizer, right? It gives them intermittent fasting, so it gives them an eating window that's really specific. It gives them real food, real nutrients, all the food groups, so they're not getting deficient while they're losing weight and burning those calories. And they don't exercise during that time. They get more energy. When I first did it myself, I called and I said, It doesn't say anywhere it's supposed to give you energy, but it's giving me a ton of energy because it just gets all the inflammation out of your body. And then if you lose 10% of your body weight, and it doesn't matter if you weigh 500 pounds or 100 pounds, if you lose 10%, your lab markers will dramatically change.
So I know it's not about us anymore, it's about them. And I know that together we're stronger than we are separate. So let's talk a little bit about Jason and Dr. Strohide and the amount of energy and outcome that he has by bringing us all together.
He is a wonderful human being. He is a really great doc. And what he has developed is really, really good quality products that are reproducible. There's so many docs here that have been using the products, and we're all getting the same results. And that, we know that the supplements industry, the over-the-counter stuff can be really tricky, but these are very, very precise, and the results, you can see the difference.
Well, I just want to say a couple nice things about Dr. Strohide for bringing us all together. ChiroThin is a huge movement within the chiropractic profession. It's only able to be used by chiropractors with a DC after their name, and it's very safe, it's affordable, it's effective, and it can help that chiropractic office actually make more money. And you're not losing your way, you're not throwing the baby out the bathwater with principle, you're actually making a healthier population around your client base, and you're actually delivering people what they want. People want to feel good, they want to look good, they want to perform good, and they have to do that first by doing the chiropractic lifestyle. But we need to know what's going on at a molecular level inside of their body, so what you're doing is absolutely amazing. But when somebody would to come to you after they did ChiroThin and they did the program previously to seeing you, you would see a whole different lab result, right?
Absolutely. I would. It's amazing. I mean, that even just 10% of their body weight, no matter where they are, will dramatically lower their cholesterol, their blood sugar, their insulin, all their inflammation markers, their liver enzymes, everything improves.
So if you start this program with ChiroThin, you will actually become a different human before you come in and see Dr. Julie and have her do your lab work for you and find out where you're ineffective with your levels. I'm not a doctor and I'm not a math professor, but I will tell people that by doing the right thing continuously, the outcome is improved, correct?
Correct. The outcome is greatly improved.
Well, I'm going to go ahead and close out. Is that okay?
Yes.
Okay.
Thank you so much.
Before we do that, if people want more information and possibly want to work with you, how do they do that?
So my website is vitalhealthprotocols.com, and my email is drj@vitalhealthprotocols.com.
So Dr. Scott Judy just jumped on with us right now. So thanks for connecting us. And I'm going to go and close out now. If you guys didn't make it to ChiroThin Forum 2019, make sure you guys put this on your calendar for 2020. And I'm going to close out just as I always do on Chiro Hustle. You guys are just one story away. Keep hustling. We'll see you on the next one.